Hello, I'm Susan Cooper, and I want to talk to you today about stroke awareness. May is Stroke Awareness Month. I would also like to talk to you about life after a stroke, the different types of strokes, the signs and symptoms of a stroke. It is also important to have the proper healthcare insurance coverage and what stroke recovery, stroke therapy, rehab, and minimal consciousness treatment looks like if you experience going into a coma like my brother Jasper Jordan did. This information is based on what I know, experienced, and witnessed as a primary caregiver, advocate, representative, and liaison for my family. Did you know that 70% of the strokes happen among African Americans? There are three types of strokes: the ischemic stroke. The ischemic stroke is where a blood clot forms in your brain. The hemorrhagic stroke is where a bleed forms in your brain, where they call it also a brain bleed. The TIA is the transient ischemic attack, which we also know as the mini stroke. Did you know that some people will experience symptoms such as headaches, numbness, or tingling several days before they have a serious stroke? Studies have found that stroke patients experience the mini stroke and mini stroke symptoms up to 1 week before they have the major stroke. I know this to be true. My brother Jasper had the mini stroke exactly 1 week prior to having the major ischemic stroke, and then later had the hemorrhagic stroke in the hospital. The one thing that we would like for you to know and to remember: to act fast. Fast is the easiest way to recognize a stroke and what to do. F is for face drooping. A is for arm weakness. Speech is for speech difficulty. T is for time to call 911. There's also another symptom that I would like for you to know, and it is the symptom that I witnessed and that I saw my brother have. It is called the sideways smile. When I saw him do the sideways smile, I did not know what that meant until afterwards. I thought to myself, why is he smiling? One side of his face went up with a smile to where you could see his teeth and it looked like he was smiling. I want you to know about that symptom also, because they don't talk about that symptom. And we saw and I witnessed it firsthand. Now I'd like to talk to you about stroke recovery. Stroke recovery also includes the medical team, a good family support system, physical therapy, and rehabilitation. There are two types of rehabilitation. You have subacute and acute rehabilitation. I would like for you to know the difference between the two, because I did not know the difference between the two until we were experiencing it and I did the research. Physical therapy and rehabilitation is one of the major key factors to stroke recovery. It even helps with brain stimulation and waking up from a coma. Did you know that there are miracle drugs to help stimulate the brain to increase motor skills and create movement? We did not know this until myself as an advocate was researching also. And I would only do research after something just didn't sound right. So you also need to know, have information, and do research, simply because Stroke doesn't have a color. It doesn't matter. Anyone could experience a stroke. It just so happens that 70% of the strokes happen among African Americans. So please join us on Saturday, June 28th, for the community-wide health fair at St. Mary's Road, United Methodist Church, to learn more about stroke care, and to also learn more about your overall health care. There will be stroke screenings, other health screenings, health insurance information, and other resources. So please join us. And to remember to put God first. Remember to take care of yourself and to take care of others and to love your neighbor and to love yourself. Thank you.